This flock of small ruminants is but a small part of the goats and sheep which are part of more than 65 million found in Ethiopia. A large part of these flocks belong to the pastoralist and semi-pastoralist communities, living mainly in lowland areas of the country. Bashere Kalicha and a great number of other pastoralists mainly depend on small ruminants for their livelihood. During the past 20 years, a fatal disease called Peste des Petits Ruminants, PPR, and locally named Mavareba, appeared among sheep and goats, as is witnessed by Mr. Bashere.
I lost many goats due to PPR. It wiped them all from one of my enclosures. The disease destroys our precious lifelines. When we lose our sheep and goats, life loses its meaning.
The disease killed large numbers of these animals, disrupting the basis of livelihood of livestock owners and creating food insecurity among them. It also negatively impacted the country's economy.
The disease decimated countless sheep and goats in Ethiopia since veterinary services were not giving proper attention to it at all. PPR was first identified during the early 1990s with the technical support of a recognized veterinary laboratory in the United Kingdom.
To this effect, the EU Share PPR project is then designed to tackle this problem by working closely with the Ethiopian government. Funded by the European Union and technically supported by the Food and Agricultural Organization of the UN, the project is currently implemented in Borana, Guji, and Bale zones of the Oromia region, all zones of the Afar region, South Omo zone of the SNNP region, all zones of the Somali region, and highland-lowland interface areas of Ethiopia. PPR project's target is to prevent and control the disease from all of its intervention areas. In doing so, it has put in place fast and reliable disease reporting systems.
The project uses a national progressive disease control and eradication strategy to defeat PPR. Its focus areas include improved real-time understanding of the PPR disease status in the pastoralist and agro-pastoralist areas of the country, improved quality and quantity of PPR vaccine production by the National Veterinary Institute, improved capacity to implement progressive disease control program, and improved national and sub-regional animal disease control coordination and knowledge exchange.
Here we see an animal health worker trained by the project using the Animal Disease Notification and Investigation System application, ADNIS, to send daily disease information regarding PPR to concerned veterinary services through a mobile phone. As assessments indicate, the ADNIS implementation sites increased from 280 in 2014 to 480 in 2018, with the unreserved commitment of 74 animal health professionals. The project also uses a paper-based disease reporting system known as Disease Outbreak and Vaccination Reporting, DOVAR. It enables the transfer of disease, outbreak, and vaccination reports every month to the Ministry of Agriculture and records electronic information on a dedicated server. As per official records, the national DOVAR reporting rate has improved from 32% in 2015 to 75% in 2018. The other mechanisms which the project employed to search and confirm diseases are participatory disease surveillance and outbreak investigation. With regard to community sensitization and education efforts, the project uses awareness-raising techniques and community animal health workers in order to educate them about disease symptoms as well as ways of preventing it and reporting about it to village-level animal health professionals. Because of that effort, this pastoralist has brought a ewe, which is strongly suspected of being infected by PPR. A team of veterinarians has therefore run a rapid pen-side test and ascertained that it is indeed PPR. This incident and the PDS exercise they undertook previously has finally called for a targeted vaccination in which all small ruminants of the area, as well as those from adjacent vicinities, were vaccinated.
Our sheep and goats are vaccinated twice and are not sick anymore. Now we regularly get milk and meat from them and feed our children and ourselves.
Thus far, we have succeeded in vaccinating nearly 20 million small ruminants over a 3-year period. In order to eradicate the disease for good, we strongly believe that we must work very closely with neighboring countries, and we are committed to that.